Okay. So once again, welcome. Those of you who are new to this and the recording, we're here to talk about occupational health and safety and change, how to build safety trust beyond compliance. I'm going to go back to my screen. Guess I'll go from current slide. The question I'm posing to the group: imagine a near future where there's been a change or new amendment to the WSHA alongside the regulations. As a leader, whether you're on a committee co-chair or you're an OHS leader, what are some of the first things you do? If it's easier to take off your mic and unmute yourself, that's cool, or you can send it in the chat. What are some of the first things you would do? Anyone?
Attend the session.
Attend the session. Maybe not this session, but a session specific to whatever that topic might be, right? It could be something ergonomic related, could be something related to
I'd review what
some other exposure.
the amendments were. Oh, sorry. I would maybe review what the amendments were just so I have a better understanding to be able to provide it to the committee and to the workers on site.
Right. Okay. So understanding your own knowledge or lack thereof, learning for yourself. Excellent. Let's go the next step up. So let's say you've got, and I'm going to use an MSI as an example. I'm not an MSI expert. We have other people on staff at the Occupational Health Center who are better equipped at this than me. But what would you do next if you felt pretty confident about the amendment and you've read through the regulations? What are some of your next steps after that?
I put this in the chat, but review our current safety program to see if there's any gaps.
Ah, thank you. And I just realized I can't see the chat when I'm in this screen. Okay, so we're going to verbalize this. Thank you. Amanda, yes, you're going to figure out what you're doing already, right? So you got to do kind of a baseline look at what you're currently doing and seeing maybe even whether you fall under that regulation or under that amendment, right? So obviously this was just a teaser. We're going to get more into the practicalities of this. But yeah, you got to figure out whether A, it's applicable, B, if it's applicable, what do we need to know as an agency and an organization before moving forward? So if that's one take-home message at the beginning, obviously as responsible professionals, that's what we're going to do. We're going to talk more about what this looks like in practice, because some of these amendments and regulations, whatever the topic might be, could be quite intense or polarizing or misunderstood, right? So you're going to see that there's a little bit more to it than just, unfortunately, researching and writing and making recommendations. It's going to be a little more involved. So here's the big idea. This is kind of my TED style big idea, is you're on the inside and we're going to look as we go outward from there. Most of the time, a typical direction of change. So when I say change, I'm talking about this idea of new compliance regulation, new requirement. It's going to come from the top down, or it's going to come from a pocket of an organization, for example, that might be a little more risk adverse. And now that might be health and safety, but it could be HR, it could be some other part, right? Or it could be in response to some major incident or event that required a lot of follow-up. So it's not uncommon for it to be like, oh my gosh, we have to get our ducks in a row and we need to go from the top down. So I'm not here to say that that's a bad approach. It's important in some circumstances, and it's not always the best for everything. And I would say for this topic, especially if we're going to use psychological health and safety as kind of this approach or kind of the case study in the broadest sense, then I think it's important to recognize you actually have more influence than you think wherever you're situated in your organization, and that it's possible to sustain positive change from the inside out. You know, if you know anything about the Occupational Health Center, like this is our ethos, is we're worker-centered. And my heart does go out to people who are kind of squeezed in the middle, people who might be out of scope, who may not be part of a union, but who are managers and supervisors who are expected to supervise and also deliver on whatever requirements are needed for their position, as well as the goals and objectives of the organization. So it can be a really tough spot to be in. So I want you to kind of, if you're feeling like that today, if this is the kind of person you feel like you're in that middle space, then I'm hoping today's presentation will give you some insight and some courage, and maybe some pats on the back too on some of the important work you've already been doing. I had a polling question for here. This is what's so challenging about this particular setup is, Lisa, if you're able to run the poll, I'm inside PowerPoint and can only see my screens. So could you do the one that's marked number 1, if possible? If not, we can keep going. Let's just take a minute here. Perfect. No, that was number 4. Can you try number 1? Maybe click back. I'll do it. Oh, let's see. I can do it. Perfect. All right. Once it comes up on the screen, I can play with it. So are you all seeing that? Organizational readiness and you. How ready do you feel your organization is to lead meaningful change in psychological health and safety? Choose the best result. Not ready, early stage, unsure. Hopefully folks can vote. Do you see it up there?
I don't have it on my screen.
You don't have it on your screen. Oh, that's irritating.
Sorry.
No, that's fine. We should have tested this a little bit better. I apologize. Let me try it one more time. If it doesn't work, we'll just verbalize. Huh. Okay. Oh, I see. I have to end that poll. And let me try this one. How's that?
Now
You
I
guys see
got
it
it.
now? Perfect. Okay. Thank you for your patience. It's always something. I see there's 23 of us here today. That's good. Okay. So I'm going to end the poll and share the scores. A little bit of a bell curve there. Early stage, unsure, building capacity had the most at 44%. That's great. That means folks, that tells me that if you're attending today, this was a topic of interest and you're already moving forward on that. And so it's okay if you scored a little bit lower. I think certainly today's topic is in an area that a lot of people aren't really comfortable with. And it's an area that I am very interested in, and I want to expand on this. But let's quickly just go back and understand kind of where we're at today. So very often what happens in health and safety is we react, right? There's incidents, there's overhauls that happen after the fact. And I'm here to tell you, especially when we're talking about issues of mental health and preventing psychological injury, we want to get away from this kind of reactive mindset. It's been an issue in the back with chemical exposures and things that are a bit more physical, but we're talking about psychological here, especially. And once again, yes, that emphasis on the physical and the associated risks, not so much looking at what we call psychosocial factors. And I would say that there's been an issue with compliance winning over relationships. So safety compliance becoming this, once again, a reactive mindset. And I want us to think a bit beyond that. Now, the Safety and Health Act is super important, but once again, it focuses on compliance and it doesn't necessarily give you guidance on how to get there. And what we're going to talk a lot about today is kind of more of the infrastructure and the person power and the interpersonal relationships that need to get you from point A to point B in a sustained way. And it's just beyond the scope of the act to talk about that, right? And so there fortunately has been a shift now towards acknowledging psychosocial factors. And I'm going to talk in a minute about how other places are doing that. And Manitoba, as we will soon see, is well on that path towards incorporating more of a psychosocial lens. And if you've ever attended any of our repetitive stress injury days when we have events in February, I'm always kind of that guy in the peanut gallery who says, okay, you're only as physically safe as psychologically you feel. So even these things like, MSIs and ergonomic issues, there's very often, if not always, a mental health or psychological component to this. And so we need to be paying attention to that. Now, the last piece I want to include here, and this came more out of the pandemic, is this idea that workplaces are somehow outside of communities, which is just wrong. And we know at the Occupational Health Center that workplaces are just extensions of the community. And so when you're dealing with something like COVID or an outbreak of an infectious disease, what happens at work is going to have a tremendous influence at home. So as you can imagine, things like psychosocial factors and hazards of that nature can very easily spill out into the home and the workplace. So, or the community. So it's not something that a lot of people, when they're trained in health and safety, are necessarily thought to think, okay, what's going to happen when folks go home necessarily, other than we don't want them to get hurt on the job. Now, leaders in the world today, when you're looking at workplace psychological health and safety, the winner is clearly Australia. And if you've done any reading on this, they have a lot of frameworks and actually codes of conduct that have expanded the idea and made it a statutory duty to eliminate or minimize psychosocial risks. And unlike other places, this code of conduct or code of practice that they use really does have a lot of bite to it, although there isn't necessarily from what I understand, you can't necessarily be sued directly over it, but you do have certain requirements with regard to enforcement, and sometimes that peer pressure is enough to get employers in certain sectors, especially to get on board. So Australia has been this kind of checkpoint for a lot of other jurisdictions. So if you ever want to do a little reading on like what the future might look like, keep an eye on what's happening down under, as they say. So another really interesting area is the European Union, which the framework is different, right? The EU, of course, is certainly a governing body that oversees lots of countries and lots of programs, and they leave it a bit more open-ended. They say, okay, country of interest, you do have to manage all workplace risks, but the gap is we're not going to necessarily spell it out, like strictly that you have to do this or that. What's interesting is countries like Germany have emerged as leaders in their own right and actually have a very healthy market for psychosocial assessors, people who come into workplaces and will do the sorts of assessments that may not be required on the EU level, but are required more so at the national level. So the EU is a little bit closer to what Canada is, which is, once again, this is a provincially led thing, and we have jurisdictions across the different provinces. And you can see here on the screen, I'm not going to go into huge detail. I can print these slides or share them quite easily. But British Columbia, Ontario, and Quebec are the three leaders, as well as the Federal Labor Code. BC is interesting. And I think what's happening is more of a certainly regulatory perspective on this, and each province is a little bit different. And so I'm not going to necessarily drill down on each of these because you know what's coming, and that is what's happening here in Manitoba, right? So you've heard of Bill 29. It came out in the summer or just at the beginning of the summer. And I joke, actually, I've been involved in some of the advisory committees that are laying out some of the requirements or some of the regulations that aren't here yet, but people say are coming. It is a little bit like the dog that caught the car, if you know what I mean. Like, okay, we've been talking about this for so long. We want to have psychosocial and psychological hazards be identified and part of an overall comprehensive program. But what does that look like? So we are one of the first provinces, actually. We are on that short list of other provinces who are expanding our act to include psychological safety. Psychological safety specifically, not health and safety. I should be very clear on that. And I'm going to explain more about that in a minute. But safety is something you can more easily quantify than something like mental health or psychological health. So those are the outcomes we want to see are fewer injuries, fewer illnesses, and things related to poor psychological safety. but the act is going to focus on that part of it, right? And of course, this idea that we need to be in alignment with current standards. And so that includes the CSA standard, right? That's my next slide. There's also national guidance through the Canadian Centre for Occupational Health and Safety, CCOHS. So really great resources, right? I've been at this job for more than 10 years. We've been promoting the CSA standard for quite some time. It's a top-down approach. It's get your leaders on board, get that commitment statement, get that policy going, and then farm it out to your stakeholders, get them on board, talk to your committees, et cetera, et cetera. So all that's great if a workplace culture and safety environment is ready for that, right? And whether that approach even fits from a cultural standpoint. So in Manitoba, we have what's called the Internal Responsibility System, right? The IRS. The Safety and Health Act talks about that to a great degree, right? This idea that an employer needs to do everything reasonable and practicable to protect workers. And I am heartened to see, especially CCOHS, talk more about, like, I like the word comprehensive workplace health and safety program. So like, I'm all for it. And I also like the implementation guidance for the CSA standard. But once again, it's a competency or compliance-based approach that's very quality, iterative, like all great stuff, all known to be good for especially larger organizations to roll out a change. My challenge, as I've done this work for a few years now, is that it's not really working from the inside out. You're not actually looking at where people are at right now. You're not necessarily having these conversations before the change needs to happen. So instead of reacting to, we got to do this, like, let's stop and do, some basic inquiry at the front, middle, and end, whatever that looks like for your workplace. And so today I'm trying to break this down and say, you don't have to take this hook, line, and sinker. And the Act does not say that a workplace needs to take the CSA standard and implement it in entirety. There's actually more flexibility than you think in what's coming down the pike, at least what I think is coming down the pike. I don't want to speak out of turn. But I do want to say very clearly, and this has kind of been new for me in terms of thinking about some of the language. When we say psychological safety, there's really two primary ways to think about it. There's the systems level, right, which is where the Act is going. You have to assess, identify, and control these hazards as they emerge. And then you have kind of more of that interpersonal, or I would say the scaffolding that is the human element, which is the built around interpersonal risk, right? Am I afraid to speak up? Do I have a team that values me? Is the culture on board in terms of recognizing failures as, perhaps a pattern or a system issue rather than a personal fault? And of course, you have to have trust. Without that trust, it all falls apart. And that's the challenge I find, is when you have a workplace, for example, or an employer that's reacting quite suddenly to, oh my goodness, we have these requirements, what are we going to do? And they push it down the pike, and it turns into this kind of checklist driven thing. And you've missed the boat, because especially on this topic, more than any other, you need folks on board, right? Or it's going to become just another part of a managed system that's going to lose its human element. Now, of course, as I mentioned, the mental health piece is what's born out of kind of a confluence of those two types of psychological safety. And that's where the psychological or the psychosocial factors come to kind of blend together. And once again, that brings us back to kind of my onion here, or my nested Russian dolls of, you're in the center of that, and you got to be right with yourself before you can kind of think beyond your team or even other teams, or what on earth is going to happen at the executive level. So it's a lot to consider, but it's also somewhat heartening, I feel, to know that you actually can do a little bit more from where you're situated than waiting for kind of directions on high. So just to cap this discussion around Manitoba, I will say that even though we don't have clarity on Bill 29 just yet, or the amendments in terms of regulations, I think you can start having these discussions sooner rather than later, so that when the dog catches the car, you're not being kind of dragged behind the car. You're not hitting a car. I know it's a very violent metaphor. I'm sorry. I'm American, so I think I have too many Too many animal death metaphors, killing cats and skinning birds and all that jazz. So these are some questions that I throw out there, and I realize I'm going to hold to my time limit here. Think about this, okay? Just self-reflection. There's no need. This is not going to be part of a polling question. But when was the last time your organization introduced a new compliance or culture change within your safety program? Think about that. How often does that happen? Now, you could say, well, it never happens, in which case I'm like, all right, well, are you staying current with what the requirements are for whatever that issue, whatever that exposure, whatever, things like, asbestos, air quality. I know with this issue around wildfire smoke, right? Like what's going to happen with climate change. So we need to be one step ahead of the curve if possible, and anticipate that there are going to be changes to the rules, right? How involved was your executive leadership in supporting those changes? It's very easy, especially in large organizations, for the decision frameworks to be siloed, right? If this is a exposure issue for this type of worker in this department, well, people at the very top, they may not be as directly involved, or they may not think they need to be involved. And I think that's a missed opportunity. That's a missed opportunity for folks at the very top to understand, what are these exposures happening? Why are some people in your organization experiencing a different sort of work life than others? Beyond counting incidents and near misses, how well do you understand why shortcuts and workarounds happen in your culture? So I worked in healthcare. I know I still work in healthcare, although sometimes I wonder, given the work that I do in organizational development. But when I worked in long-term care for several months when I first moved to Canada, I know one of the workarounds was, believe it or not, people stealing supplies off of other people's carts, right? Whether they were nurses, whether they were personal care aides, kind of not a great thing to do. And then you could maybe put stuff back on their cart when they weren't looking. But those are, I would say, unsafe workarounds, because who knows what was needed by the other person on the other shift. And so there are consequences to some of these workarounds, and people just say, well, that's part of it. This is the way things are done. If I'm going to steal from Peter, I got to, get back to Paul or whatever. And there's something happening there about the working relationships that definitely come out of a culture and expectations with regard to how we treat each other. So it's not just about incidents and near misses. It's more about the day-to-day things that we may or may not be able or willing to notice. So when mistakes or rule bending take place, how do you respond as a culture generally? Do people go like, ooh, that was really bad. That was like borderline negligent. How could you let that happen? Or do they stop and think, okay, well, maybe there's a system or a pattern here. Maybe you're not the only one. I know in healthcare, when I was moving up from the States, and I still think it's the case here in Canada, there's been improvements in how medication is stored, for example, right? If the generic medicines or the whatever are in alphabetical order and one sounds like the other, but they're very different medication, and if you grab the wrong one and administer it quickly, yeah, it's on the nurse to slow down, do your name checks, confirm with another person, make sure you do this safely. But it's also about where you store this stuff, right? So let's make it a little bit harder to mix things up. So depersonalizing, looking at this as not so much a personal failure, but as a system challenge. I think, once again, you're reframing it in a way that's going to provide for more positive improvement. And finally, are supervisors equipped and confident to notice early signs of strain or disengagement and to respond with care rather than control? So think about that. And this has to also do with workload management. If your supervisor has, 50 direct reports, are they even capable of doing that, right? So that is, workload management is one of these factors, one of these psychosocial factors that supposedly need to be assessed and understood before we kind of throw people into the wood chipper. So once again, these are just very much thought-provoking, and I included them just as talking points, and you can certainly take that back and do with it what you will. From a concept standpoint, though, I think it is important to frame this around strength versus compliance, or really being proactive versus reactive. And I choose to go through life with more of an optimistic lens. I do believe people mean well. I don't think people mean to come to work and do wrong by others or be, pains in the neck. So certainly if you're a leader, you need to lead with, I think, that kind of a human-centered perspective. If you're more business oriented in the sense that we've got to meet our requirements, and I think sometimes safety people can get into that mindset too, where it's like we've got to check our boxes and get this done, because if we don't, bad things are going to happen. So I know it's a challenge, and I know workload doesn't help with this, but this slide, I was joking with Lisa earlier, my slide notes are through the roof. You could just build an entire afternoon just around this one slide. I'm not going to go into huge detail. I think it's fairly straightforward, but it does require a little bit more investment on the part of leaders to think a little more deeply and a little more relationally when it comes to, affecting change. And by change, I am talking about rules or compliance or regulations or whatever. Now, maybe you haven't heard this, but this is another term called the compliance trap, which, as the name implies, can send you down a rabbit hole of, maybe we are in compliance, maybe we're getting everything done, but is this really a nice place to work? So thinking of compliance as the floor, right? So if we go back to the psychosocial risk assessment, which we will definitely be returning to, you may be required to do that kind of assessment, but do you stop there? Or do you actually round it out with some other questions, some other inquiry, being curious, right? So this is once again where I think, especially with things around mental health, don't just think minimum, think we could go up one level. And so naturally, over-reliance on the rules breeds this kind of complacency and really stifles innovation. Like, you're not going to find creative ways to solve intractable, difficult problems if all you're doing is, well, we're going to try this, this, and this. It didn't work. Okay, well, if we're not going to get caught, then let's just perpetuate a broken approach to problem solving. Now, it just really does depend on the sector. I think, my work in manufacturing, I'm always impressed with the degree to which, key performance indicators and things are carefully quantified. And I get it, like, this all needs to be done and the rules are there for a purpose, but just don't forget that there are people, there are bodies behind this. And we can't just think of this as a series of checklists. So for the remainder of our time, we've got about 25 minutes, we're going to go through kind of some approaches, some perspectives, some ways of thinking that are going to get us out of this mindset, out of this potential compliance trap, and into a more fulsome, more integrated, I like to think more holistic and person-centered approach to leading change, especially around health and safety. Now, I would say the number one or one of the top strengths of a safety culture is really what I call healthy curiosity. Now, why is that? Well, you can imagine, when people are afraid to speak up, if these unsafe workarounds are happening, just in general, they don't even need to be triggered by some massive change or thing coming down the pike. It could just be day-to-day lived experience. Are you noticing that? Or is this just the way the world is and this is our work? So Lisa, I want to do another poll. I think poll number 2, if you wouldn't mind running that, starting it, and then I can take over. I think that's how this works. Perfect. So which part of your organization seems most affected by stress, burnout, or fear of speaking up? Now, I understand that there might be some overlap here with some of these choices. We've got frontline shift workers, support or administrative staff, supervisors or mid-level managers, professional folks, senior leaders, or anyone not listed. And I remembered, okay, so folks, if you listening on the recording, you're not going to be able to see the polls. Sadly, they don't show up on the video. but it's a group of 5 types of workers. And where are you seeing the most challenge with regard to mental health? And we usually wait till there's about 80% taking it. Okay, yeah, not a big surprise. Frontline and shift workers clearly win that dubious award, 83%, saying that your folks on the front lines are most affected. And that might include professional staff like nurses or people in healthcare who are also on the front line. Okay, that's good to know. I think that might also include maybe frontline supervisors too. All right, so in the next couple minutes, I want to just outline a framework that I've been working on for a while. I just didn't really have the words for it. And so I've been using tools to do this. I won't say which tools. I think we can all imagine the day and age we're living in. But this is a framework that pulls from kind of change theory, but also from some of the psychology around building kind of what we call self-efficacy or confidence to move forward with something, right? So in healthcare, like when we're working with clients, when we're working with injured workers, for example, how can we imagine for them, or how can they imagine for themselves, really a brighter future? And I do feel like that's an important role we do at the Occupational Health Center with regard to injured workers, is we kind of help them find their inner voice so that they can either self-advocate, they can join forces with others, or work with newcomers, helping them understand their workers' rights. And so I feel like this audience, right? Like these are other important constituents for our clinic, and that includes professionals, people in positions to affect very positive change, I think, in workplaces. So that's what this is for. This is now kind of to help support people who are in your position, perhaps, who might be looking at these changes coming down the pike and being like, where do we get started? So I'm going to cover this. I guess I got about 10 minutes, but we're going to move through here. I have framed this around, let me go back. I used the term elevate, and I used the phrase conscious change because what I think was missing in some of these implementation guides is this piece, is moving from an inner space through towards engaging your teams and talking about issues, building that psychological safety, and then integrating. Okay, and it's kind of like, you can think of it as 3 phases. That insight for yourself, what do I need to learn? And at the beginning, when I posed that question, what happens when there's a change in the act? What do you do? Everyone who spoke, mostly the response was, I don't know enough about this. I need to go learn. And once I've learned that, I need to figure out, okay, is this applicable and to what extent for my workplace? So that's actually where the insight happens, right? Is conscious change begins inside and whether you're in a good state of mind to start that for yourself and start that for your team, that's what happens there. Then as you move more towards into kind of that influence, that's where you're like, okay, we need more engagement from other groups within my organization. I would say that does need to include human resources, that does need to include executive team folks, people who may be on the sidelines with regard to some of the other health and safety issues, but not this one. This one, we really need them involved. And once you've built that, you move into, I call it a collective baseline exercise. So you integrate. You're like, okay, we are kind of maybe weak in this area, but we're strong in these other areas. What do we need to do to move forward? Okay, well, now we know we might need to do a psychosocial assessment. What tools should we use? What approach should we use? Do we need to use what the government experts say we should use, or are there other validated tools out there that we might want to consider? And do we have the resources for that, right? So this isn't rocket science. I don't think I've invented anything here that isn't really out there already. Although when I did some research on this, I found that there's not really an approach like this for health and safety leaders. And certainly, it's so easy for change manager folk to get really into the weeds with regard to, process diagrams and flow charts and things. And I love all that stuff. Don't get me wrong. It's just, we gotta focus on these personal insights first. So I'm going to go through this really relatively quickly. I wish we had more time, and I think this could become more of like a larger workshop. And so at the end, we'll send out an evaluation if people want to learn more about this or talk about it. I say it's a draft emerging thing because I'm learning too. And each of these three areas, I came up with these on my own. The educate yourself and engage your team. So each one of these is going to start with an E, moving forward. Okay. So educating yourself, we talked about this already. What are the things? What are your own gaps? This is also about your professional development. Where do you want to go, right? Do you see a future for yourself in this organization? Is there an alignment there? If there isn't, then maybe you're not the one to lead this, and that's okay. Giving yourself permission to maybe step back and allow maybe a mentee or someone you're bringing up to kind of take more of a leadership role. All of that is all about self-awareness, right? The next piece, of course, is engaging your team. And I am a big fan of using strength-based reframing. That means rather than drilling down on all the mistakes and problems, and in healthcare, we're the worst. This is the diagnostic issue, or these are the tools we're going to use to solve the problem. And it's very easy for us to go into that kind of headspace. And so actually just having casual conversation. How's it going? What's going well? What are some strengths? What are we really good at when it comes from a health and safety standpoint? When we're, maybe you're really good with your incident response, or you're really good with debriefing a certain type of whatever, right? And so are you aware enough of what you do well as a team and as an organization? And could you share those sorts of lessons learned with other people? Now, there are ways to do this, and these are some questions. I love these questions. These were first written up by Dr. Amy Edmondson and her team, 2008. That's a little while ago now, but this type of approach ages very well. And these are just questions or statements that you can use. You could use them in a survey, or you could frame them as an open-ended question. Do you feel like you can speak up without someone shutting you down? Or when you make a mistake, are people taking a second look, or are they assuming the worst? Right? And so this is getting at kind of those interpersonal fears that keep people at bay. And I would say, regardless of the issue, regardless of the change to be undertaken, unless you have people at the team level engaged and feeling like they can trust their colleagues to the point of opening up and sharing good ideas, bad ideas, I call it the good, the bad, the ugly. And it's even when there's the good stuff, right? And collegiality and these things that all really matter, if they're not there, your higher level attempts at changing anything in your workplace they're going to fall flat. Okay. So this is where that insight needs to happen personally, and then at your next level up, which is the team. Now, I have that little megaphone says I would have asked a polling question, but for the sake of time, because I want us to have some discussion, I'm just going to move ahead here. The next level, of course, if you can think of it like we're going outward, right, is the influence. And that means first enlisting. Okay, so decision makers is a broad term, but that includes anyone with really any formal power. That could include your executive leaders. That could include people in your HR department. That could be just department leads, whatever that is. If you feel confident that your team is on the right page or right pages, and there might be some changes that need to happen, and maybe you've thought, okay, well, psychosocial health and safety, this is important. We're going to kind of lure them in a little bit. There are ways to persuade and do it without coming across as, too intense. We call it carrots and sticks. So there are tactics that can be used. And that's also where, when you Google something like healthier change tactics, you don't actually get a lot. Interestingly, they want to talk about resistance to change and all of these things. And I'm kind of like, well, if there's a resistance to change, probably because there wasn't much of a relationship there to begin with. Because if people are given, an opportunity to fully understand what the issues are, why this change needs to happen, even if the answer is no, people appreciate the clarity of closing the loop. Okay, because no one likes to just talk into a void And this is the worst. You do a survey and you do it anonymously and you don't ever hear back. That's very not good, right? Because you do that enough times and you're gonna erode the trust between your staff and your workforce and leadership. Because people are busy and they're, I know for me personally, like I'm actually not on social media much these days just because I have my own kind of ethical reasons around it right now. I've chosen, I don't have like the closest massive friend network out there. I choose to put my eggs in a basket of, probably 10 people. There are probably less than 10 or 12 people in my life that I'm going to give most of my attention to. And, so it's quality over quantity. Now, everyone's got different values. I'm not here to say don't go on social media. You do you, right? But just being consistent in a way that is true to you, true to your team, true to really the values of your workplace. And sadly, in highly unionized workplaces, unfortunately, and I know we have some of you folks here in the audience today, the idea of labor is really not person-centered. Labor is treated as just another line item on a budget. And you don't feel like you're part of a team. You feel like you're a cog in a machine. So until you start to break down those sorts of practices and beliefs, you're going to have a harder time really affecting or in a positive way the mental health in a workplace. So anyway, there's practical ways to do this, and I've got lists of tools and things at the end, but I'm going to keep going. So finally, if you've done your homework here and you've gone inner space, a bit outer space, looking at your teams and folks you can bring to the table, then you sit down and you're like, okay, what can we do? What is required of us? What can we afford to go above and beyond? And this is really the readiness for change. Not to use a buzz term, but makes sense to me. You can have personal readiness to change, organizational readiness to change. And there's theories, right? Like trans-theoretical about pre-contemplation, contemplation, blah, 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 all the way up to decision-making. So I should clarify that everything I'm showing you in these three kind of buckets are all in that contemplation stage, in that like, okay, we think we need to do something, but we're not sure yet how to do it. These are the lines you got to get in a row before you even choose a tool. So I think it's easy for workplaces to be like, okay, well, now we have the regulations. We're going to go right. We're going to pick a tool and we're going to do it. And I'm here to say, whoa, slow down. You can actually cause harm if you just jump into a tool and apply it without thinking, more relationally. So between establishing your baseline, and I know, like, let me back up and say that the amendment to the new regulations that are coming, and of course the amendment to the act says that it's assess, identify, control. So we are not talking about controls today. We are not talking about what you're going to do when you get that baseline information. All I'm talking about today is just getting you up to the starting point where you even choose what kind of tool to use. So that's time for another discussion in terms of we're taking our data, we're going to interpret it, we're going to do something with it. Okay, so when I say here, E, evaluate your learning, I'm talking about evaluate your learning and getting you up to this point. So this is where health and safety committees can be super useful, right? And if that involves some internal dialoguing and surveying about what it was like to get to this point in the decision process, great. And what I mean by mixed methods is not just relying on a survey, but actually sitting down, reimagine what an inspection might look like. When you do your 3-month inspection, are you walking around and just looking for trips, slips, and falls, or are you actually talking with folks? Are you asking them questions about the work, about, you could even tuck in some of those questions around psychological safety, right? So avoiding that survey reflex. And once again, in theory, in reality, it's not so linear. It's more of a, like a gear system where one influences the other. So I put it linearly at first, just to help you kind of understand that you got to get kind of right with your own thinking and perspectives before you approach your team, and then you move up and out from there. But in reality, truly healthy workplaces who are advanced in some of this are going to go back and double check and make sure that the gears are still turning. So if I had time, I could give you lots more examples. I think at the end of the day, you're going to want to just take maybe a harder look at what you're already doing. How could you better utilize safety huddles? How could you better? I already mentioned the inspections, right? And so we're not looking at reinventing the wheel here. We're looking at like identifying your strengths and what's going on well. Because the other thing I tell organizations, you would not be in existence if you weren't doing a few things well. If you were negligent to the point of true harm and unsafe situations, you would be shut down, right? So there have to be some good things going on. Otherwise, yeah, you would be a different place. Maybe not a place at all. Okay, so I've got like this slide and one more, and then I'm done. These are just some sources. I could talk your ear off on some other ones. Lisa, if you're able to drop this into the chat, there is a toolkit. This is a draft toolkit that I developed. I sent it over to Safe Work Manitoba to try and incorporate into some of what they're doing in the run up to some of these regulations that we hope are coming soon. But it's kind of more of a guided coaching guide for any reader or anyone in a position of authority to think about, how ready are we for a psychosocial assessment? What would be needed to get to that point? This other one, Psychologically Safe Team Assessment, is an online tool put out, I think it was Queen's University were the real brains behind this, in collaboration with Canada Life and CCOHS on how to assess your team. I haven't practiced or used this tool yet. I'm basing it off of the powerhouse trio here of these important partners. But our other folks, of course, OCal has a mental injury toolkit that's very good. It's also been around a while, as has their stress assessment tool, which competes a little bit with Guarding Minds at Work in terms of which is better than the other. And the people who do the validated survey research on this have their opinions, but I would say if you're willing to do stress assess or Guarding Minds at Work, those are more intensive. They're an anonymous tool. You do need to have some IT capability on the part of your staff to use it and hopefully give them time to take it, and it's not on their own time, right? But I think, moving forward, it would be neat in Manitoba if we could figure out some other ways to, in a bona fide way, assess for kind of psychosocial issues without always having to rely on an anonymous tool. Now, anonymous tools are the ones that are validated are very, very good, but they do take a bit more intensive resourcing. So there has to be some other options for people. And I should say that the province will be releasing a tool that you can use that's straightforward, but it won't be validated. It won't be like Guarding Minds at Work or Stress Assess, which is okay. The Act does not require a validated tool be used. It does say you have to have a competent user who delivers it, but otherwise, it's good that it's in there, and I'm glad we're going to be talking more about it. So this is my final slide. I hope this was useful. Please take some of these ideas. We make these slides available. Think about what you're doing well. Maybe there's some gaps. Maybe there's some opportunities. There will be future guidance coming with regarding to Bill 29. I guess it's not really a bill anymore. It's been a law. We'll just call it the amendment to the Workplace Safety and Health Act. I would also like to throw out there, there's my email address. If anyone on the call today is interested in furthering this discussion, I know I am committed over the next several months to commit. I think as an agency, we're really looking at how to prepare workplaces, especially the ones who may not feel quite so confident or have the resources to take on a whole assessment. And it is a bit like deer in the headlights, right? And I'm here to say it doesn't have to be the most complicated thing in the world. It can be a series of things that you are doing. You just have to document it, right? I mean, that's the thing. If you're ever audited, you just got to show that, we did our due diligence and we relied on this source or did it this way. But yeah, so fortunately, the Act, as I understand it, and I, once again, cross your fingers, we don't know what the regulations say. They're going to keep it flexible enough, I hope, that people aren't going to be locked into, one type of tool versus the other. But yeah, whether that's a community of practice or something in the future to just talk about lessons learned and things moving forward, give me a shout. So that'd be really good. Okay, well, I left like 5 minutes. Sorry. I had grand hopes of doing like a whole 15-minute Q&A.